Hello, Partnering for Vaccine Equity Learning Community members and others working on vaccine equity. Welcome to this afternoon's learning event. I'm Jenny Haley. I'm part of the group learning team for the learning community and on behalf of our team at the Urban Institute. Thank you so much for joining us today. One of our roles as group learning managers is to get input from all of you on what kind of support you need to advance your goals for vaccine equity and create opportunities to get that support. And one thing we've been hearing from our members through various channels is that many of you want to hear from each other about how the programs are going, lessons you've learned, and how you've adjusted your approach over the months that you've been doing this great work. And that's how these quick talk sessions came about. Our purpose today is to highlight the work of learning community members who have graciously volunteered to tell us about their programs with these 5-minute quick talks. And then they're going to facilitate small group discussions in breakout rooms later, where you can all share your own experiences with Partnering for Vaccine Equity initiatives. All of our learning community members, just so you know, are representing organizations that have entered their second year of Partnering for Vaccine Equity funding. And so part of what they'll focus on is how the programs have evolved from one year to the next. Before we go further, I'll do our typical quick review of how the session will work. You've all been muted upon entry to the session. Please stay on mute unless you're speaking, just to keep things going without accidental interruptions. We'll be using breakout rooms in the second half of the session after the quick talks. And when the time comes to move to a breakout room, you'll randomly be assigned to one of them and automatically sent there, so you don't have to do anything at that point. The chat room feature is also open today, and we encourage you to use it. Introduce yourself or type a question for the speakers at any time. We are not planning to do a Q&A after each short presentation, but the speakers may be able to answer some questions in chat, and we reserve some time at the very end of the session for general Q&A. We do offer live interpretation from English to Spanish during our events. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar down at the bottom of your screen. And finally, as with all of our learning events, we will post the slides and a recording of the event on our community website, and we'll circulate these through the digests that go out through the CDC managed adult vax program listserv, which all program members should be a part of. If you have technical difficulties at any point during the session, please send an email to our community managers inbox. That's vaxequitylearning@urban.org. And we'll be watching the inbox, and we'll try to help you as quickly as we can. So now it is my pleasure to introduce our featured speakers. I will say their names and very, very brief introductions in the order in which they'll be speaking. And I'm just so excited to hear these great presentations. First up, we have Candace Parker, who's the COVID flu community liaison at the Wellness Coalition in Montgomery, Alabama. Next, we'll have Dr. Heatherlyn Uphold, who leads the National Network for COVID and Adult Vaccine Equity. She's also an assistant professor in the Department of Translational Neuroscience and the Division of Public Health at Michigan State University in Flint, Michigan, and co-director of the Healthy Flint Research Coordinating Center. Dr. Su-Ying Wu and Dr. Alice Jo Rainville are representing the Center for Health Disparities Innovations and Studies at Eastern Michigan University. Dr. Wu is a professor and director of the PhD nursing program there and directs the Healthy Asian Americans Project. And Dr. Rainville is also a professor of nutrition dietetics and co-leads CDIS's nutrition domain. And last but not least, we have Dr. Elsie Smalls, who is the operations manager of the COVID-19 and flu grant at Healthy Savannah in Savannah, Georgia. So again, thank you all for joining us today and sharing your experiences with us. We will now get started with our quick talks. Candace, you may begin whenever you're ready.
Hello, everyone. I'm with the Wellness Coalition. The Wellness Coalition is a nonprofit organization that has been around for more than 20 plus years, and we are located in Montgomery, Alabama. And within the Wellness Coalition, we have a program with the COVID and influenza, which we service Montgomery, Macon, and Lowndes County. Our target population is African Americans who live in low to moderate income communities. And what we do, we educate high risk and high disparity communities about COVID-19 and influenza. So within our one-year paid funding program, we have been able to partner with 6 local pharmacies that's located in Montgomery, Lowndes, and Montgomery, in Macon. And we also have coordinated over 30 vaccination clinics, working with different churches, back to school events, as well as clinics with the county of Montgomery, as well as news stations and there so on. We have also hosted clinics at venues other than a faith-based organization. Next slide, please. So our goals and activities for year 2, we have we want to include luncheons with different businesses to educate them on COVID-19. We just want to get a feedback from different people in different communities. And we want to partner more with work sites in Macon and Lowndes County to have vaccination clinics. And the reason we chose Macon and Lowndes County is because with Macon County, they have a history of the Tuskegee study, which was the syphilis. So they're a little hesitancy about COVID-19, and Lowndes County is a low populated area with few businesses. So it's difficult to get in those counties and to those communities. We also want to, well, our pearls of wisdom, we're applying from year 1. Number 1, we want to meet the community where they are. And by saying that, we tag along with other planned events in the community. We have partnered with Montgomery County, providing vaccines for the sanitation workers. We also have partnered with local businesses in the county for 2 wellness health fairs in Montgomery, Macon, and Lowndes County, providing vaccines to those communities. Number 2, it's not what you know, it's who you know. We have worked with trusted messengers in our area, as well as managers for basketball teams and county commissioners. Next slide, please. Our discussion topics, we have had a few challenges over year 1, and one was partnering with local pharmacies. It started off slow at first, but it did pick up to, as we said before, partnering with 6 local pharmacies. We had to cancel a clinic due to low registration and participation. Hosting vaccination clinics outside of faith-based organizations, meaning as we partnered with churches, but we weren't getting outside businesses. So that started to pick up as well. And then getting our survey assessment done, the paper copy was slow. So we did make a few changes for year 2. We created a QR code for our survey assessments, which you can access through a QR code on your phone. And it's like a 2-minute survey that you can complete. And then in the past, we've partnered with major corporations for a series of vaccination clinics, such as one of our big Hyundai suppliers, Mobis. We partnered with them for a COVID flu series, and they were very helpful and promoted the vaccination clinics very well to the employees. So those are a few things that the Wellness Coalition has done in the past year to year 2. And I just want to thank you for this opportunity. Thank you.
Thank you so much, Candace. I will now hand it over to Dr. Heather Lynn Uphold of the National Network for COVID and Adult Vaccine Equity.
Perfect. Thank you so much. So thanks for the opportunity, number 1, to get to hear from so many other great folks doing similar work. Our project is the National Network to Innovate for COVID and Adult Vaccine Equity, or NNICE. And our work involves 8 different partners working in 8 geographic locations. You can see we're in Chicago, Illinois, several sites in Michigan, Baltimore, Maryland, and Eastern North Carolina, where we're focused on African American, Black, and Hispanic Latinx adults. On the next slide, we talk about what our purpose is, which is to build the evidence base of interventions to improve vaccination coverage, as well as identify and implement strategies to reduce disparities in adult vaccination amongst our population of focus. So during year one, we did a few things. We identified implementation partners. So these are trusted community organizations. They're experienced in regranting funds and supporting community organizations. We also identified 8 promising practices, which is how we address vaccine uptake and equity. And the way we identified those practices is we looked at the literature, saw what other folks were doing around vaccine uptake, and then took that information and shared it with our partners. We said, what do you think? What's your feedback? And also, what are you doing in the field that's successful? And this process provided us with a final list of 8 promising practices. We then supported our implementation partners in the selection of subawardees. Now, these subawardees are the ones that are implementing the promising practices. So they're the boots on the ground, right? They're the churches, the grassroots organizations, the ones near and dear to our heart. We also provided technical support in a variety of methods, one-on-one meetings, all the general ways. But we partnered with another consultant. Her name is Dr. Shanina Knighton, and she's an infection preventionist. She met weekly office hours where she was able to support subawardees around implementation and just strategies around COVID and vaccine uptake. Our anticipated results include funding upwards of 40 subawardees who will then reach roughly 185 individuals through those promising practices. So like many of you, we just closed out year one. This week begins year 2, and where we're focused for year 2 includes 3 key areas. So we're going to continue the implementation, but it also, this kind of gives us an opportunity to step back and look at our promising practices, see if we want to make any modifications or expansions, and then continue to fund those subawardees. We're also continuing our focus on evaluation. We have a great partnership with the Michigan Public Health Institute, who is using a culturally responsive and equitable approach to evaluation. So this engages our implementation partners at every single step of the evaluation. And we're also focused on gathering information for a toolkit. So that's one of the things that's going to come out of our year 3 efforts, is the toolkit to support the implementation of promising practices. And finally, we want to share what we learn with others. And this includes providing our results with other NNICE implementation partners and subawardees. And the reason behind this is that our partners have been right there with us, creating the story of NNICE. And by giving the results back to them, we create community dissemination ambassadors, and we support the sustainment of their work. So this enables them to seek additional funding to expand their works and their effort. And it also allows them to possibly apply those promising practices to address other public health issues. We have, similar to what Candace said, we learned a ton during the first year. We all know how important relationships are in being effective at this work, but we have to maintain them. And what we found is that just like any other relationship, continued communication and transparency are critical. And we saw that the reward, the effort is so worth the reward, right? So the amount of effort that we put in, we just are seeing such wonderful relationships develop. We also learned that support looks different for different folks. So the needs in Michigan with Flint and Grand Rapids are different from those in Baltimore. But by maintaining continuous and flexible communication, we were able to meet everyone's needs. On the next slide, I talk about the 3 areas that I hope we get a chance to talk about in groups. So number 1, COVID looks so different right now than it did last year, and likely will look different in the fall. I'm interested in figuring out how do we normalize this and make COVID vaccination just another thing we do to take care of ourselves. I'd also love to talk to folks about what you're seeing in the field around interventions and promising practices. And then, my heart and soul is in dissemination. So how do we equip community with results to support their sustainability? Thanks.
Thank you, Dr. Uphold. That was great. Next up, we have Dr. Su-Yin Wu and Dr. Alice Jo Rainville from the Center for Health Disparities, Innovations, and Studies at Eastern Michigan University.
Good afternoon, everyone. Thank you so much for having us. And my name is Su-Yin Wu, and together here with me is Dr. Alice Jo Rainville and also Sarah Lawley. here we are going to share with you our journey working with Asian and Arabic Americans in Michigan. So next slide, please. So here we are, see us, that we are kind of have a statewide effort. You know, if you think about Michigan, it's like a palm. So we are mostly working statewide in the lower peninsula, not much in the upper peninsula of Michigan. And like I said earlier, we've been working with Asian and Arabic Americans in the three areas that we've been working since the first, grand period, starting with flu, then COVID, is that we are using the community participatory approach to really understand the barriers and challenges to vaccine uptake for our priority populations. And if you know the literature, it's that there not much out there about what are some of these information for Asians, Arabic population. And that's why I think it's very critical that to be out there. And what we've done in the process is through the surveys, through the listening sessions, more like what you've seen in focus groups. And using these tools and mechanism, we learned the major challenges that in different Asian groups and Arabic communities. So we've been doing this in about 7 different groups together. And whenever we go out there, and we have interpreters with us, and so we really provide the culturally sensitive and language approach, appropriate approach. Then the second areas of our focus is we would like to equip influential messengers, and so we provide education training and empowering these trusted voices. And as you can see that we've done up to now, we just recently did another one, trusted messenger training, and we have trained more than 80 trusted messengers. And then the third area is that we would like to increase the vaccination opportunities by working with the multi-sector partnerships, and as a result that we have done the more than 50 mobile clinics and vaccinate more than 4,000 people. And for some of the area, this may not be a lot, but I just want to share some of the unique characteristic we find in the process is that even though in the early phase that we have this mass vaccination site, but through our needs assessment, and we are reporting this in one of the publications, is that these limited English proficiency individuals that we work with, even they have computer access and they have internet, but they don't go to these major mass vaccination sites for a variety of reasons: language, cultural barriers, system, challenges, and low health literacy. And that's why we're using some of the things that Alice Jo is going to share with you, the GIS approach, as one of the best practice to identify these sites and mobile sites and serve our populations. Alice Jo, I will turn it on to you.
Thank you, Dr. Wu. Next slide, please. Okay, so our goals as we enter into year 2 are identifying pockets of vaccine hesitant communities. And so this is becoming a challenge for us. So we're interested in what others are doing. Also combating the COVID pandemic fatigue with relevant information. And we all know that things change daily with where we are with COVID vaccinations. And so we're staying on top of that, but we find that in some cases, communities are experiencing COVID pandemic fatigue. We hope to increase our mobile vaccine clinic reach and utilize multimedia approaches to education dissemination. Some pearls of wisdom We find that the community participatory approach is very valuable. We're learning our myths and misconceptions from our community listening sessions. And the advantage of the GIS approach, it allows us to see where our clinics are reaching those most in need of vaccination. And we can also look at that in terms of social determinants of health and the social vulnerability index. And so these are ways that our GIS expert on our team, Dr. Yang, is helping us with our GIS maps that show us how we're reaching those who are most in need of vaccination. Next slide, please. We're looking forward to discussing with you in the breakout rooms. How are you identifying your vaccine hesitant communities? What have been your biggest successes and challenges? And what are you excited to work on for year 2? Thank you.
Dr. Wu and Dr. Brainfield, thank you so much. That was great. And we have our final quick talk now with Dr. Elsie Smalls of the COVID-19 and flu grant at Healthy Savannah.
Hello, everyone. Thank you for this opportunity to share this afternoon. Very similar to my colleagues that have gone before me, we have done some of the same kind of things in the Savannah, Georgia area. I, along with my colleague, Michelle Hoskins, serves as the communication manager for the COVID flu supplemental grant with Healthy Savannah. We're located again in Savannah, Georgia, and our primary focus is working with Black and Brown communities that are often underrepresented, underserved, and are at higher risk for critical illnesses as it relates to COVID flu, but other health disparities as well. A higher hospitalization, higher death, that we all know are very, unfortunately, very common around the Black and Brown communities. The supplemental grant came as a part of a REACH grant that we have been serving the Savannah community for over 15 years. Some of the highlights from our first year of funding and to maximize the outreach and the impact and the engagement from the community, we developed, with the help of community members, a community health advocate program. Very similar to others, we did listening sessions because we wanted to hear from community members what they were hearing, what were their fears, what were their concerns, what were their perceptions, and what were their experiences as it related to the COVID pandemic when it hit the communities. And so from that input and guidance, we developed a training program. And so over the course of this year, we've been able to train 50 community members coming from all walks of life, from health profession to the school system to people working in their health ministries at their church, for someone just that's been retired and now we're really excited about being a part of a solution as it relates to the communities that were hit so hard. And so now that community health advocate program are the boots on the ground, doing the work, networking, sharing information on COVID and flu access, awareness, and acceptance. Another highlight and key component of our approach in this first year included engaging the faith community. We know that in many communities, the faith partners are where there's already relationships, networking is already there. So we were able to award 15 mini grants to faith partners to implement community activities or outreach events and engage the community again in the area of educating access, awareness, and acceptance of the COVID flu, about COVID flu. And so these partners did everything from a gospel concert to block parties to just having live conversations with health professionals to share with their respective communities and hear again the concerns of the people that they were serving. Next slide, please. So based on what we experienced in the first year and what we learned, particularly through our community health advocates' feedback from what they were experiencing, we want to integrate a more holistic approach to address the long-term health and wellness in our community outreach. We know that, again, as someone has already mentioned, COVID fatigue is upon us. And so now how do we prepare for the future so that we're more proactive versus reactive? And so a part of our outreach for the future will include engaging the community and sharing with them about how do you engage in terms of physical activity, increasing physical activity, access to healthy food and nutrition, making sure that what your environment is doing, and also mental and emotional health as it relates to that holistic approach, so that we again are more proactive and versus reactive. God forbid something like this should happen again. We want to expand and elevate our outreach in the Hispanic community. We have a tremendous partner as one of our community health advocates. Beatrice had this pearl of wisdom that you see here. I saw this as a tremendous opportunity to amplify the message to the Hispanic community. Beatrice is committed to her community, and so we are strengthening that partnership by making our presence, making sure that our materials in both English and Spanish, which are the primary languages in the communities that we serve, and making sure that we, again, present and supportive of any kind of outreach activities that are happening in the Hispanic community. That is our commitment for year 2. And then, of course, making sure that as our community health advocates progress into year 2, that they are talking not just about COVID flu, but also about how do we stay well as a whole moving into the future. Next slide, please. And what we hope to explore in our breakout sessions is one or both of these is how do we, again, engage in effective strategies to address COVID fatigue. It's still upon us. How do we keep the momentum going? And how do we, again, expand the partnership with the faith community? Thank you so much for your time.
Thank you, Dr. Smalls. Really appreciated the insights that all of our great speakers shared. Thank you so much. Okay, so now we are going to have everybody move into breakout rooms. As I said, you'll just automatically get placed randomly into one of the rooms. And we have a few of the discussion questions that I'm putting in the chat right now to discuss during the breakouts. So
the questions are, what are your experiences getting surveys assessment on your program? What are some ideas for getting feedback from participants versus the paper copy versus the QR codes? Another question is, what are some specific promising practices that you are increasing vaccine uptake and equity? And another question is, what are you most excited about working on in the next year of your program? So does anybody want to start with the questions and answers? We'll start with the first question. What is your experience on getting surveys done? I know we have a goal at the Wellness Coalition. We have a goal of 700 by a specific time. So I was just wondering, what are people's perception of getting their surveys assessment done? Hi, everyone. My name is Shan Kaur, and I work with the Wellness Coalition, but I'm under a different COVID program called Health Equity Alliance. And the way that we've been getting surveys done is when people come up to our tables, we offer them a bag of swag in exchange for doing a survey. We also have little QR code cards just in case people don't have time to fill out surveys at the events. We just give them a card and they can do it later. So that's what we've been doing for our Health Equity Alliance program with surveys. And our goal is 300. So thank you, Shan.
Good afternoon, everybody. I'm Sean Verdoni. I represent the Pro Healthcare Foundation. My partner, Saul Juarez Aguilar, is on vacation this week, but our grant focuses on the work that his group does through our Hispanic Health Resource Center. And we don't necessarily, we don't survey those that are getting vaccinated, but we have a focus group of community influential messengers. And so we survey them on a regular basis. And our goal for this grant is to receive 100 influential messengers into our program. And like I said, periodically we do provide surveys to them so they can let us know what's working and what's not working in our program. And I don't have any updates on that piece yet, but I'll certainly ask Saul when he comes back from vacation.
That's great, Sean. Does anyone else want to talk about their experience with getting surveys before we move to the next question?
I mean, I'm on the same team as Candace. But at first it was a little difficult with the paper versions, but we were able to get a little QR code called, oh, okay, you can see it like that. But you scan it with your camera and we're able to get something like that. So if anyone is doing surveys, I suggest get little business cards with your survey. It's much easier.
Thank you, Michelle.
Can I ask a quick question? Just because the learning community is thinking about work that how we could support survey development, because so many PAVE members are doing it. Are you all creating your own questions, or are you using question banks, like getting questions from other surveys that you've seen or from partners?
I know here at the Wellness Coalition, we have an evaluation team that comes up with our questions.
Okay.
So that's how we get ours.
Okay.
Our questions are primarily focused on the specific things that we're doing in the community and how the community is responding. So I'm out on a limb here, but I feel like we're doing our own questions.
Yeah, that would make sense in that case. Okay, that's helpful. Oh, thanks, Christian. Okay, so yeah, it's probably a mix of approaches, but yes, that's something we're going to try to get a handle on. Thanks.
So the next question is that I really want to discuss is what are you most excited about working on in the next year of your program? I just want to see where everyone wants ideas for the next year on their programs. What they have planned for the next year. I guess I would say events, coming up with events, thinking outside the box. More so outside of health fairs, because we always do health fairs and things like that, resource fairs, but kind of like thinking outside of the box as far as like a bingo game night where we could give away gift cards for people that attend. And that way you can educate people and they can also get that incentive, probably doing that in partnership with local bingo halls here in our county or surrounding counties that we go to. So just thinking outside the box, trying to come up with creative ways to keep the conversation going about COVID, keep the conversation going about washing your hands, keeping your distance.
I like that idea. I think
great
something I'm
idea.
excited about is trying to do some luncheons with companies here that have a lot of our priority population employed with them. So, getting some donations from our local Publix or whoever is able to donate and just provide them with lunch for the day, and as well as educate them about COVID and influenza vaccines.
So I got was that Shantavis? Did I say that right?
Yeah,
So
Shan.
Shan?
Mm-hmm.
For Shan? Okay. Shan, so have you received only positive feedback on the incentives, or have you received a mixed bag? Because, and I'll tell you why I'm asking, we thought incentives was like the way to go too, because we have a very poor Hispanic population we serve. They actually came back to us in one of those focus groups and said that the community did not want to participate with incentives because they felt like they were selling their health. And so I was just curious if the communities that you're working with, if you had heard anything like that, or if they were more engaged because of the incentives.
I would say here they were a little bit more engaged. We've noticed that in order to get people to show up they're looking for something in return. If it's just a little gift card or if it's a goodie bag of swag, like they're just looking for something in return. We haven't had any negative feedback. I will say we have been kind of cautious when it comes to promoting that we're giving away gift cards, like at vaccination clinics. We like to specify that we're giving away the first 15 people will get a gift card. So there's no confusion when people show up to these events and we've given out the first 15 and they think they're going to get a gift card. So we're just trying to make sure we specify on flyers. But other than that, no.
Excellent.
That's interesting.
Yeah, I was shocked too. I thought for sure, you know, if being in a poor community that, you know, they'd love the free stuff, but they equated that to something negative. And I was like, wow, the focus group has given us so much valuable information about how to tread these challenging waters. So let's see, I was going to answer the question too. So here's something that's really, really cool. We reported on it on our last report. So we partner with a Spanish speaking radio station in the Milwaukee area. It's got a reach of about 250,000 Spanish speakers. So it's multi-county wide. And we also, because of that, we're able to participate in a podcast to talk about our work getting vaccines to the Hispanic adults. And through that, a county that's like 2.5 hours away from us reached out and said, you know, they're actually having a kind of like a growth spurt for the Hispanic population in their county, and there's not enough resources in that county to help support the COVID vaccination of these individuals. And so they heard about what we were doing on our podcast, and so they've asked us to kind of be their kind of like benchmark, you know, role model and utilize our materials and our processes and see if they can't get more Hispanics vaccinated because of what we've already created. So that was really cool.
That's great, Sean. So I think we have a few seconds left. Does anyone else have any comments or anything they want to add real quick? Bridget, do you have something?
No, we'll be, because we're doing great on time. So based on where we need to be. So there'll be time for us to kind of report out when we go back to the main room. And Candace and I can kind of tag team that, or Candace, you can get started. I can add things in what we heard, and then I think there'll be time for you all to add in the main room, because we're doing pretty well. You all did such a good job sticking to the 5-minute speed dating talk, so that's hard.
And I just put in the chat some of the discussion topics that come up across the various speakers. But since we're lucky to be joined by all three of you from this program, of course, we can kick off with whatever you'd like to talk about.
Hi, everybody. How are you doing? Sorry for the noise. So happy to be able to share a space with all of you. And I think that starting out, you know, I would really love to hear if anyone has any questions from anything that we talked about, just as a starting point. All right, cool. If not, and again, you know, I don't want to interrupt. If anyone did have a question, please interrupt me, or feel free to put your question in the chat. One of the questions that I have for all of you is, we have, you know, an ever-changing landscape when it comes to funding and funding opportunities, and you know, because I know we all come from different places, different backgrounds with our organizations. And so I'm curious to know, how all of you navigate mobile vaccine clinics or getting, you know, vaccines to your priority populations, and kind of what that looks like for you.
So I can talk. I work for the center. It's the Mohawk Valley Resource Center for Refugees in Utica, New York. So in terms of vaccination pods, because we serve such a unique population and really require language support to assist folks, we have done a lot of vaccination sites on site at the center in partnership with a local healthcare clinic, which it's a known location to our populations. We have an interpretation department, so we can support people in many different languages. And we're a fairly small city, so it's fairly easy for us to get the word out and get communication out, whether it's social media and we have a lot of ethnic staff from the communities that we serve. So we're really able to make sure that people know that they're able to get vaccines here on site. And then we also partnered with the county health department, as well as the kind of local healthcare system. So if they're going out into the community and doing a mobile site, you know, we can have folks go and assist with that with language support. Our program specifically uses community navigators. So we have selected and pay on a part-time or contracted basis community members from the various populations we serve that act as kind of our way to get information out and make sure that they are providing correct and accurate information. So I think it's much easier for us because we are a smaller city. So our reach into the communities and making sure they get the messaging and the right place to go for clinics, our vaccination pods has been relatively easy for us.
Jennifer, can I ask you what some language you mentioned about the language support? So what are some of the ethnic groups you serve in the refugee population?
So we have a very large Burmese, and of the Burmese population, Karen. We also have Sudanese and Somali, Congolese that are here. We recently have been resettling Afghan, as well as we're starting to see Ukrainians here now. And overall, I mean, this is a city of about 62,000, and 30% of the city speaks another language other than English at home. So, and in large part, it's due to the work of refugee resettlement here. We've, over our existence, we resettled over 17,000 people from 36 different nations that have come here. And then we also have a lot of secondary migrants. But those are primarily the populations. So Arabic, Burmese, Karen, Ukrainian, Spanish. We also serve a large number of immigrants. And then depending, it might be Rohingya or the Congolese, often Swahili. So it really kind of depends on what populations we're kind of targeting. I think someone mentioned in the larger group, you know, places of worship. So if we are doing something that's targeting a particular place of worship, we know which language is going to be the predominant language, and adjust accordingly the staff that we have present there.
Thank you.
Mm-hmm.
And I'm also curious, in the state of New York, what does your funding look like for things like the flu shot? You know, or are you finding like who's helping with that for people that don't have insurance or covering additional costs that you have?
So, of course, when it comes to the COVID vaccine, that was covered. And with flu shot, this past season, the federally qualified healthcare clinic that we partner with would provide those. They were providing those free. If someone did not have insurance, they would not turn anyone away. But many of the populations, so if individuals have come as refugees, they are eligible for Medicaid. So generally have health insurance. But we may be serving some undocumented immigrants. So in that case, you know, they generally would just cover the cost for that. We did not turn anyone away.
That's great. Thank you. And anyone else that's here right now, I would love to hear the same, I have the same question for all of you. Just how are you navigating your mobile clinics, especially because recently, the administration fee funding was, not renewed and things like that. And so are you seeing challenges when it comes to the financial part of it, when it comes to your mobile clinics?
I can talk a little. So we're a prime organization, so we have 16 different subrecipients that we're funding through the Partnering for Vaccine Equity Project. About half of them are federally qualified health centers, so they're able to tap into other sources of funding to pay for vaccines. But in terms of the mobile clinics, most of the federally qualified health centers are able to use their outreach staff to create mobile clinic opportunities. And then we also partner with several universities that have either community health worker training programs or partner with community health workers. And they've been able to tap into those networks in order to provide mobile pop-up clinics. And most of them also partner with their local departments of health or with other local vaccine providers in order to generate mobile pop-up clinics. We also have one partner that's university, and the partner is with the School of Pharmacy within the university, and their vaccine equity project is basically to get community pharmacies throughout Puerto Rico to ensure they are promoting both COVID and flu vaccines. And so it's because of the prevalence of community pharmacies, there's many more community pharmacies as opposed to chain pharmacies in Puerto Rico as opposed to here in the mainland. And so that's their project, is to basically empower those community pharmacies to be able to provide vaccines in their local communities, and make sure that they have the resources that they need in order to do so.
That's great. Thank you both for that, for your feedback and telling us, anything that we can learn from each other, we're always really excited about. And so I am also wondering what are your strategies for reaching those groups of people and communities that are vaccine hesitant? Because I think that, all of us within the people that we work with, our community navigators, we have a certain level of buy-in about, the vaccines, especially COVID, being safe, being effective, being necessary. But how are you, locating and then, able to work with the groups of people that really have no interest in the vaccines at all?
Guess it shows what a difficult question that is if no one has it. What about you all? Have you been trying anything in your group?
You mean us? Yeah. So, we continue to do education sessions, and through those education sessions, there's, sometimes we're reaching one or two people in a group that, haven't been vaccinated, and really just listening to them to hear more about their story and hear more about how and why they feel the way they do. And then we continue to follow up with some of our community leaders that, we know are vaccine hesitant, and we just continue trying to initiate the conversation because, even if they
Hello, everyone. I'm sure, I'm thinking that we're in our breakout. This is our breakout room.
Yeah, it seems like it.
Okay. Well, again, thank you. I'm looking forward to, I guess, I think we have about maybe 10 minutes or so to focus our attention on one of the questions from, that we shared in our group time together. And the faith community, again, as I mentioned in my presentation, was a really good, it was an excellent connection, and we were able to build upon a foundation that had already been established. We know, again, as I mentioned, in many communities, the faith partners have already laid a foundation. They already have a relationship, and there's a place where many people go, and there is a trusted place that many people go to. And so when we use this or engage that, and we'd already laid a foundation through other work through Healthy Savannah, but we were able to expand in the COVID flu work. And so as the future evolves, even though we were able to engage 15 faith partners to take a part of the events and put on their own events and, reach more people, that is, I believe, is an important part of what we were doing for years to come. It has always, again, been a foundation of how community activism has occurred, engaging the faith community. So I wanted to have some conversation about thoughts on whether, number one, if that's something you have done, and what any value you found it, and how we might be able to continue growing work in that space.
Well, I'll try to respond. The director of the Alliance for Progress is Edgar Carmona, and he's the one that does the on the ground work. So I'm not speaking as personally doing this, but in the Spanish community in the North Texas area, there's a lot of small churches, Spanish-speaking churches, and he had the organization, the Alliance, had a relationship before COVID, but and there was a group, but it was more one-on-one kind of thing. I mean, they did speak together, but COVID brought about a method to reach everybody through Zoom, and they had not done Zoom. They didn't know Zoom. It was all brand new to them. So we have these meetings where we get on with 19 or 20 pastors of these churches and talk through Zoom that way. So that's been really good to reach people through Zoom and to have events in their parking lots of churches. So but you can only, after a while, these small congregations, you've reached quite a few people. So, but have gone back to some places for boosters, a few months later, that kind of thing, to pick up more people. So that's been fruitful for us.
Thank you for sharing that, Lori. And like you said, it's going to vary by community. What are the demographics? What are the the kinds of faith partners that exist in that community, as to how much you can do and how it will look. I think I would like to, when you're talking about working with the faith community, it is very important to be mindful, like you said, of the demographics, of the structure, of the ability to engage, and what's important to them, and how asking. And that was one of the things that came out in our listening sessions from both our community members and our faith partners is, tell us how you think this should look. What's important to you and how you want to hear it. And so that, I think, was very, very important in the work that we were able to do, and how we were able to engage, is just letting who we're working with, are hoping to partner with, tell us how you want us to look, and not,
Yeah. Was it your slide that said meeting people where they are?
Candace said that, and one of our community health advocates said, you don't go about preaching to people or trying to tell them what to do, because they will shut you out. You have to listen. It's so much about listening. Even
Yeah, I thought
if
that was really good.
yeah, meeting people where they are. We have some other folks with us. Please chime in if you have any thoughts about how we can expand, or if that's something you think might be helpful in the communities that you serve. No? Well, if you could put in the chat, I see your names, but could you tell me where you're from, what areas of the country you're in? That would be helpful just to get a sense of, because as I mentioned, one of the things about working with faith partners is the demographics of the community that you are working with and the area of the country that you're working in has a different impact for different people. And any thoughts on COVID fatigue? Have you run into that where people are just saying, you know what, we've been dealing with this masking and social distancing and hearing about COVID for, we had no idea that in 2020, when everything shut down, that it would be almost 3 years later and we're still dealing with this, if you will. Any thoughts on how to keep the momentum going and keep people aware that COVID still exists and what it might look like in the future?
Hi, my name is Michelle Newman. I work with SJ Youth and Family Services. We are located in Chicago. Primarily, we serve the far south side of Chicago. So for me, definitely experiencing COVID fatigue within the populations that we serve. Predominantly, I see African Americans in the Latinx community. So I do outreach out of a community college a few times a week, and that's primarily where I see like a lot of the COVID fatigue. Like people are just on the go, they don't want to hear about it, they don't want to talk about it. They just avoid it, and then once I like, oh, what do you do? Because they see the things on my table and they're like, oh, what do you do? And once I say COVID or vaccine, it's an instant, oh, no, thank you, I'm not interested. And I'm like, but wait, there's more, like this, I'm not forcing you to make an appointment. I'm not, I'm just simply telling you your options, what you can do, how you can protect yourself, how you can protect your family. Or even if I find that a lot of people just want to vent. They want to tell their story. They want to, I always call it their pandemic story, their COVID journey. What was it like for you and your family? So that's kind of how I get over that hump, but still even, it's just a lot of pushback on the topic itself.
Thank you for sharing that, Michelle. You are so right. And I like what you just said about sometimes people just want to be heard or let them tell their story. And like you said, we're very clear when we're sharing information. It's not about trying to force anybody to do anything. It's not about saying you have to do this or that kind of thing. It's about just sharing information so that you can make an informed decision. But I think that is definitely something that perhaps all of us can build upon, is giving folks an opportunity to tell their story. Just hear me out. What has been my experience and what, how they're feeling at this moment. Yeah. And just creating that sort of conversation relationship. Maybe is, you may never see this person again, but giving them the opportunity to just tell somebody about it could definitely change their minds.
Yeah, definitely.
So thank you for sharing that. I see that, we've got North Texas and Chicago and Washington, D.C. And again, like I said, I'm in the South. And so I think, as I mentioned, whatever part of the country you're in and the demographics that you're serving and what the foundation of the organizations you're working with, what kind of influence is already existing in the community can definitely influence what your work might look like in the future. Any other thoughts?
Well, we've done a lot of prevention work, as I'm sure all of the organizations have in the past. Have you had a mammogram? Do you check your blood pressure? All that kind of stuff. So the COVID message just kind of gets blended into all of those, this screening, that screening, going to the dentist and all of the things that you have to do to take care of yourself. You can't stop talking about it.
No, you can't.
So that's the tricky part. So blending it in together, and these just we talk about HIV prevention, all that stuff. So it just it's more blended in with those kind of topics other than pulled out. So yeah,
and I
have to do it.
And I agree, that's a great approach for the future, because that's, again, how we're going to be moving forward is COVID flu still exists, but we also want to talk about preventive. What are the other kind of health concerns or health and wellness things that you need to know about that will serve for the long term. And so I think that is key in terms of how we move into the future.
Yeah. Well, that's good. Thank you for leading us through the discussion.
Thank you.
Hope you had a great conversation in your breakouts. I would now like to invite each of the speakers to share some of the themes that arose during your conversations.
So I guess I'll go first. In our breakout room, we discussed on how programs were getting surveys done, and some of them said that, well, I know the ones that was in my group was from the Wellness Coalition. So we do have 2 COVID programs here, and both of us have different surveys, and we both use QR codes for our surveys. But I know the COVID influenza, we also use paper surveys. Our other program, they use their QR codes and incentives. It's gift cards. It's for getting their surveys done. And Sean also stated they have focus groups, and they give their surveys to their influent messengers. So that's how they come up with ideas and how to go about getting to the community and their people. And we also discussed what ideas everyone had for next year, and they had some great ideas. One person said a bingo game night, just for people to talk about the COVID and just getting information and things like that. And then one person said doing luncheons with different businesses. So that was some ideas that were thrown out there for just getting to the community and to the people.
I can pick up off of that, Candace, because we found similar things. Folks are doing listening sessions, going back to their stakeholders, going back to community and seeing, what are the hesitancies, what are the areas that we need to address with more information, as well as creating safe spaces through house parties for folks to really begin to say, I don't know what to do around vaccinations, offering raffles, right, of what started out as a vacation or, tickets to local events, but nonetheless, something to capture folks' interest and whatnot. And then somebody, an individual put in the chat that, of course, August is National Immunization. If I mess this up, just come off mute and fix it. But August is National Immunization Month, and 37.1 million adults and adolescents have missed a vaccine dose, which was just eye-opening. I mean, you expect some delay because of COVID and lack of access and things like that, but not necessarily over 37 million doses. So definitely, oh, there it is. See, look at, she's amazing. It's already in the chat. So you can check that out too, but common themes that we were seeing as well.
Hi, I will go next. In our breakout session, we talked about how do we expand and elevate engaging the faith community. And what was shared is, of course, we come from different parts of the country. I'm in the South. We had some folks from DC, Chicago, so all across the country. And a lot of what's going to drive that is, the demographics of the communities that you're working with and what those faith partners are important to them, or what they have on their agenda as relates to other work that they're doing. And so, again, we talked about how do we revisit those faith partners and listen to them, let them tell us what's important to them. How do they want to hear it? Who do they want to hear it from? And how does it look to them? And then taking that information and moving forward in what those partnerships might look like in the future. The conversation also evolved into Covet fatigue. And, we know that people just don't want to talk about it. One person shared that, when she sets up her table and she has her information there and people stop by and they see COVID flu, they immediately just put up their hands and say, I don't want to talk about it anymore. But one of the things that has happened sometimes in that engagement, giving people an opportunity to tell their story. What has been their experience? How did they feel? Etc. Then begins to open up the conversation a little bit more. And so I think an important part as we move forward in addressing COVID fatigue is creating, as someone has already mentioned, a safe space and a safe opportunity, a respectful and honoring opportunity for people to tell their stories. And then, we can continue to build the momentum from there. Thank you.
In our fourth group, do you want to go ahead and share a few thoughts?
Yes, thank you. So we were talking a little bit about strategies for mobile vaccine clinics. And so when we are talking about, different communities we are serving and who we're partnering with, because funding looks a little bit different from state to state. We had also started talking about how we reach out, locate, and then network with communities who are more vaccine hesitant. But unfortunately, our breakout room closed right as we were kind of getting into that conversation. And so we're always really happy to talk and learn what other groups are doing because it's certainly helpful. And so thank you for the opportunity here.
Thank you all. Well, now we can open it up for any other discussions that folks want to have, Q&A for our great speakers, or I see one comment in the chat, but if anybody wanted to chime in, please go ahead.
Good afternoon. This is Benita from CDC, and I'm just really glad to hear a lot of the things that you guys are doing. A lot of you are doing a lot of awesome work. I know I had the opportunity to work with my folks in Montgomery, Dr. Smalls, Sally, and Dr. Tu. You guys are really doing excellent work. And as we continue to do this work, we realize that the need continues to grow for a lot of things. I think I just put in the chat that the the program to support meals for children is going away. That is going to be somewhat of a detriment on the family. So anytime we're trying to implement programs such as these, we have to think back basically to the Maslow hierarchy of needs. Families are going to be thinking about food and shelter and other things first. And so, as I mentioned earlier, we already have 37.1 missed vaccine doses among adults and children, and that number is growing. And in addition to that, we see that there is monkeypox on the horizon. And in New York, we have a measles outbreak. And so it is extremely important that, we also try to address, how can we address the family in terms of ensuring that we get them in or encourage them to get vaccinated, not just for COVID, not just for flu, but other missed vaccine opportunities. So I think I put in the chat the link to the National Immunization page that has a lot of resources there. I think a lot of you are familiar with it, but just wanted to hear if any of you had some ideas or thought about some things for back to school, and if you're partnering with other organizations such as food shelters, local organizations in your community, what type of community engagement activities that you're doing to bring these partners together so that they each can contribute, you know, their field of expertise or their services to an event, to make it an event where at least multiple things can be addressed. And also there are a lot of different programs out there. If you check with the congressional district areas in your program. I know in Georgia, one of our congressional leaders brought to the state of Georgia a program to address mortgage, not just rent, but mortgage. So when my church had an event, we had someone from that office come out. We actually had 2 congressional leaders come out. I was kind of able to pull the coat, to pull the leg on one of the other ones because she's my sorority sister, and had her come out, and her and her staff got vaccinated as well. But we were able to tap in to that community. And we found that there were so many people, the man at the corner that owned the sandwich shop, he fed everybody that was there. And at least we got people in to give them information about the vaccine. And those efforts continue with my church. And I just love PAVE because I see the wonderful things that you all are doing. I know Dr. Smalls, you guys are doing something. I'm really excited to hear about any of you all that have submitted abstracts to APHA or other conferences, whether they've been accepted or not. We'd love for you to share because that's a testament of the great work that you all are doing. So thank you for allowing me to comment and to add and to contribute to your feedback. Thank you, guys.
That's great stuff, Benita. I literally want to go out to lunch with you and just pick your brain even more. What we're seeing in Michigan, so of course, in the Flint area, we have the water crisis that's been going on since 2014. There's also another water crisis declared in one of our other geographic locations, Benton Harbor, Michigan. So what they're doing is pairing that crisis with COVID. So with water distribution, with addressing those community needs, they're also providing the information around COVID.
That's awesome. Are you familiar with Dr. Cleo Caldwell, the University of Michigan?
No.
Okay, she is funded by CDC through our internship and fellowship program. And some of the opportunities that the students were doing were around the Flint water issue or the issue there. And a lot of them were addressing COVID. I would be more than happy to give you her contact information. She's the dean of the School of Public Health at the University of Michigan. And they've been doing a lot of things, and they've been utilizing some of their undergraduate and graduate students as an opportunity for continuing education, internships, or an opportunity to do work study to help do some of this work. So it's been a win-win situation because it has also placed some of our racial and ethnic minority students, or those that are interested in minority health, in an opportunity where they can be exposed to public health while working with the COVID pandemic. So I'd be more than happy to share her information with you.
I would appreciate it. Thank you.
You're welcome.
Such great ideas raised. Benita, I'm excited to hear if anybody has any responses to your question about back to school events or the ways they're particularly engaging families. I know that's been on a topic that's been on a lot of minds in this group.
Well, I'm Karen Renee with the Atlanta NAACP. What we have been doing throughout the COVID vaccination is we've been hosting 2 food distribution sites every week, and we've given out over 6 million pounds of food. We just completed our back to school supply giveaways, and we just did 2, and we're doing, and the city's doing another one. We just donated some book bags to them. But what we're finding in our communities, especially in the Black and Brown, the poor communities, is that not only is there a food desert from grocery stores, but elderly people who are taking care of kids are not getting the necessary food stamps or have even access to get to where they need. And so even though we try to do the best that we can, offering, working with food pantries and food, we work with the Atlanta Food Bank, and some other food banks on the other side. And so it's been a very difficult task just making sure that they have like a nutritional balance in meals. And what we're seeing is since last year, our numbers have increased with the lines are growing longer. I think that we probably need to focus a little bit on that as well. And at these sites, we do encourage and support the vaccinations to keep these families safe. And I agree, there is a COVID fatigue now, and young people are saying that if you could test negative for it, but still have it, you know, so how do you know you have it? Is it just pneumonia because it's in your lungs? And so we try to offset some of the misinformation, if you will, to make sure that we're giving them good information as we travel through this pandemic. So those are some of the things that we're doing in our area. Thank you.
Jennifer, as if I might offer, it connects to what I mentioned earlier about our faith partners that we work with. We sent out an RFP to our faith community and invited them to apply for, again, a mini grant to do back to school events. And, you know, of course, integrating community resources, the access and information on COVID flu, but also about how, again, to prepare student supplies, et cetera, for the back to school, and as well as other community resources. So we saw this as a way of, you know, addressing several different issues, but also with several different partners in different parts of the county. And so we partnered with, again, our faith partners to do those back to school events so that we could reach more people.
Fabulous. Thank you all for sharing these great ideas. Unfortunately, we are at the end of our time now. We do have a quick poll, if you don't mind answering the satisfaction poll while you're here. And we're excited to tell you about a few more upcoming events we have. On August 15th, we'll be talking about coverage and how to understand and connect communities to affordable health insurance coverage. Then we have our social media workshop series throughout the month. And then the end of the month, we'll have a partnership with the National Hispanic Medical Association. And coming soon, we have a couple of other great, exciting workshops, one of which is about legislative awareness and advocating. So thank you so much for joining us. And if you could please join me in thanking our fabulous speakers. We really enjoyed these quick talks. Thank you so much to all of you for being here today. Have a great afternoon.